Dear President, dear Guy Valenciennes, ladies and gentlemen, directors, it was very important for me to be with all of you here this morning, even throughout the screen remotely, for this new edition of CHAM. As a Minister of Transformation and Civil Service, it was very natural for me to be with all of you, and I believe that this is the very first time when the Minister of Public Transformation and Civil Service is with all of you. But I think that for me, it was not normal not to do this, because you are indeed those who are making live and evolve and transform our healthcare system and as well as our civil service in the hospitals. I really, just to start all of this speech, I would like to applaud your approach, because your approach is the approach of sharing, of opening, and you are doing it, first of all, Mr. President, throughout this convention, starting from 2009. Me, myself, I'm absolutely convinced of all of this, is by mutualizing, putting together the expertises and energies, whether they come from the public sector or private sector, that we will be able to somehow find solutions to all of these challenges that the healthcare sector is facing right now. And I'm thinking here about the demographic people getting older and other problems that we have here, and the attractiveness of the jobs in the hospitals, for me, is also one of the priorities. I believe that in order to make sure that the civil service is attractive for us, we have to first of all work on the wages, but also work on everything, all the surrounding elements, starting by the beginning of the career of the civil servants. I think that we have to focus, and for all of the civil agents, I think that we have to focus on this fundamental question, which is the condition of their work. And we must make sure that the civil service is there, corresponding to all of this transition, in compliance with all of this. I think that this is how we will provide the answer to all of this. And in order to find a solution here, I'm very attentive, together with my colleague Aurélien Rousseau, who was with you yesterday evening, to have this very open approach, non-competitive approach for all of the jobs in the healthcare, by inciting, by motivating to the possible trans-mobilities, and also to work on the territorial level in order to steer the employment there. And I was saying it, my very first priority is to make sure that the civil service will be adapted to all the challenges of our time. And the very first level here is the ecological transition. So starting from the beginning of my work here, for me it was very important to make sure that the civil service will be at the very first line in order to somehow act at the for the ecological transition. So we need, first of all, to be educated with respect to all of this. And one of my goals was to make sure that all of the civil services will be educated by 2027. For the hospitals, it's already here. So we have already started all this training this summer with CHAM in Marseille. And we have 6,500 hospital managers that will be trained starting from today and until the end of 2024. So this is the challenge that we are working on right now. Another important question right now is the digitalization. And I have said it very clearly, we have to stop opposing digitalization and humanization of our civil services. I cannot really explain to the agents that are requiring today to have a very performant tools and that must now work with very obsolete tools. They will say, well, we have always worked like that, but I'm always saying that the healthcare sector that have been working throughout this couple of last years through this very important transition, and we have the public side but also the private side and the private stakeholders here, because for us it's very important to also define the rules of the game for the data sharing. We have to define the lines of this sharing with the investment into the infrastructures, so that to be able to free these energies of the innovation and all of the healthcare stakeholders. And I was also talking to the French Care recently, and the French Care also shows us that we are able to transform the healthcare sector. I think that is absolutely necessary, and I think that I'm talking to you that are convinced of all of that. And I think that as civil service, we must make sure that we do not ask the French to pick between going to the window and like in presence or doing it online. We don't have to oppose humanization and digitalization. And I believe that the best example of all of this are the debates around the artificial intelligence, the generative artificial intelligence. You you have placed this topic at the very core of all the work that you are doing, and it's absolutely right, because I'm convinced that we have to trust the civil agents so that to use the generative AI to use it to get more time on the field to talk to the users and the patients, and probably spend less time on the repetitive routine tasks. I have wanted from the month starting from October to launch this experiment with 1,000 civil agents, voluntary, that will have this generative AI so that to help them to do some of their tasks, everyday tasks, faster and more efficiently. And we will be able to really see the impact of artificial intelligence on this job, on the work of the civil servants. I was saying it, we have to adopt the civil service to the stakes of our time. It means also that we have to include all the new expectations of the public servants in their work. And in June of this year, I have launched this very important consultation for all the civil servants so that to get their opinion on a very, very concrete topic, which is their everyday life at work. And for me, this is something that is very important because I have 6 commitments here, 6 commitments that must be for the civil service here. The first one is the managerial practices. The second one is, of course, the equality between males and females at the working place. The third one is around the health at the workspace, which is also fundamental and very important. The space and the tools of work, the simplification for the civil servants and also the HR function, and finally, the housing questions for the public sector employees, which is fundamental as well. We have 104,000 civil employees that have already contributed to all of this, and these contributions are very rich. And I know that among the themes of these consultations, we are sharing a lot of important interest points, and I will talk to you about the results of all of this in the upcoming weeks. I wouldn't take too much time, so I'm coming to the conclusion very often. I know that your program is very full and very rich, but I just wanted to add a couple of words on 2 topics that are extremely important for me and that are very much related to the transition that I was talking about right now. First of all, this is the prevention. And second of all, it's the HR transformation. For the prevention, I just wanted to tell you directly, for me, this is a priority that is very much related to the working conditions. And the civil service does not have enough understanding of this important challenge right now in terms of health. I have already told that at the Hospital CHAM in June, when I launched this plan that I have here to have a better follow-up for the chronic diseased in the civil service, because tomorrow the civil service must become the territory of the promotion of the health care. So when I started working on this job last year, I made the complementary health care one of my important priorities, because you know that health and health-related programs will be very quickly rolled out in all of the civil services. That's very important because, we are basically using your knowledge and the knowledge of all the experts in prevention that are here with you today, so that to strengthen the actions related to the prevention and the promotion of health as close as possible to the field. And I would like also to do all the screening that has been organized within the administrative services, so that to think about the programs of prevention and promotion of healthcare within the public service, the civil service. Just to give you an example, for the first time in the upcoming November, we will launch this important operation of prevention, and we will do it in the Reunion Island. And this will be tackling the topic of diabetes, which is very, very important in the Isle of Reunion. And this important campaign will, first of all, tackle the screening, but also will have a lot of training sessions and awareness raising sessions. I would like to really disseminate it in a very important way, to value this time of training for health in the career of all of the agents. I think that paying attention to the health of the agents is also very important, and it's also very important to pay attention to their moral health, because it's not acceptable for them to be harassed and violated, which is why I have announced the measures of the prevention of this violence, but also the measures of the follow-up in the situations of violence and harassment, so that to allow to them to complain right there and then. And these measures are here for the civil servants, but also for all the agents that are working, different operators, and I'm here thinking about the insurance, the social insurance offices and other services. So it's very clear for me, they must not be alone facing this violence and this harassment. This is not acceptable. And the very last word on the simplification of the HR and the managerial transformation. I would like for us to value even more all the merits and the skills of the civil service. We should do it, and this is part of your themes of work, that the evaluation of the actions of each and every civil servant should be strengthened. And I completely share the necessity that the President has mentioned with respect to all of this. And it has to be, merits has to be recognized and skills as well. We have globally to have this individual commitment and collective commitment that will be paying off and be valued. And this is why I will be working in the upcoming weeks with the trade unions and with all the stakeholders, so that to build a project of a law that will be reforming the civil service based on these essential principles: compensate the merit and encourage the initiatives in the public function, and also to put the skills and the competences at the very core of the career. So I will need your ideas, your expertise, and all of your opinions in order to be able to move forward there. So I would like to wish to all of you a lot of great debates, and to tell you, see you soon. We will continue to move forward and to transform the world of healthcare and the civil service.